IQVIA, as a company, I want to introduce to you who we are, what we do, and then drill down a bit into my specific division and the project that I'm working on and how we're using Looker. So we're a very big organization. We have over 50,000 employees, and we are the result of a merger at the end of 2017 between a company that held the world's largest curated medical data supply, IMS Health, and the world's largest clinical research organization. So they were quintiles, and they were performing the actual clinical trials. So we merged, like I say, end of 2017, and created IQVIA. So we are a human data sciences company, and what we are attempting to achieve is the resolution of some of the biggest challenges facing pharmaceutical sector and industry as a whole. So as you can imagine, and probably with very little sympathy from the audience, I'd imagine, there's a much tighter regulatory system in place around pharmaceuticals now. And that, of course, has a big impact in terms of the time and the cost that it takes to get things done. And what we're really trying to do, and this is very high level, but the key purpose for us as an organization is to take an innovative approach to technology and data to resolve some of those issues. And so, you think about machine learning and AI. One of the very, very cool examples I think that we have, and I'll go into a few more of the specifics a bit later on, but an example of this is remote trials, so remote clinical trials. So one of the biggest costs at the moment to bear for a clinical trial, if you want to get a drug tested, is actually physically getting the guy that you're tested on, or girl, delivered to the site that's performing the investigation. With remote trials, you can use new technology, something as simple as a smartwatch. You think about the amount of data that's being collected on you from your health, but also things like we have technology now where you can take a blood sample and deliver the results electronically. So you can actually take the clinical trial to the patient and have the results to return to you. So cool stuff like that. These are our four sort of key capabilities that we talk about as IQVIA core. So domain expertise, right? We have a lot of very, very clever people, both within the commercial world, the clinical world, and the technology world. I should stress now that I come from a commercial and business background, so this is going to be very much non-technical presentation. I did actually bring a developer with me, but he's pissed off to one of the other talks. So that's going in his performance review. But if you have any technical questions, I'm just going to go blank and maybe walk out the room. So we have domain expertise, we have transformative technology. I'll talk a bit about the technology platform that I'm working on specifically in a bit. And unparalleled data. So as I mentioned, we have the world's largest curated healthcare data. And to that, we apply advanced analytics to deliver results for clients. And really, the key thing is the combination of these applications and these capabilities that we apply within the multiple different work streams that we work with that really, I think, help us stand out. So for IQVIA, I work within a division called real-world evidence. What is real-world evidence? So this is any medical data that you are gaining from outside of a clinical trial. So as an organization, we hold hundreds of millions of de-identified patient records, and we get this from multiple different sources. So electronic medical records. When you go to your doctor, that creates an electronic medical record from across the globe. We also get it from hospitals, from pharmacies when they're selling you the drugs, and from insurance claims. More and more you're starting to get into social media as well. There's a whole range of different aspects from which this can come, but really this is the primary source of the data for us at the moment globally. And what's the purpose of this, right? So you think about it, if you're having a clinical trial performed, obviously, by definition, it's within a clinical setting. And in most instances, what you're going to get is probably a youngish person who probably has maybe only the single disease on which you're testing, or maybe nothing at all. In the real world, you're going to be dealing with a 90-year-old lady who's got a range of different diseases, comorbidities, all of which are going to be having an impact on the drug and her journey, right? How that drug is impacting her. and her resistance or otherwise to the treatment. So what we're trying to do with real-world evidence is to develop a better understanding and a more complete, rounded understanding of what that patient journey is like. So who's using this data, this real-world evidence? We work with a range of different organizations, public health and government bodies. So these are the people that are creating that regulatory framework around drugs and pharmaceuticals. Obviously, the people that are actually creating the drugs themselves are very, very keen to know how they're working in the real world. We have consumer health organizations. These are guys that are wanting to deliver and connect the patients directly with this information. The investigator sites, these are the people that are actually performing the clinical trials, the actual locations where it's going on. And the pharmacies and the wholesalers, so the people that are selling it. Of course, all these people very interested in the real world evidence that we are collecting. So how are they using this? What are the specific examples that we're doing? So I come originally from a clinical research background, and I remember specifically, the costs and the effort that used to go into actually finding these patients. I remember one specific example we had where we needed to test the drug. We had to inject it into their eyeball. And I'm going to shock you now, but we really struggled to find anyone that's prepared to do that, right? Weird. So a lot of what we can deliver and what the benefit that we can deliver is to actually say, well, we know exactly where the people with these diseases already are, so you can set up your trials to pinpoint them and target them in a really efficient way. Another project that I'm working on is prescribing behavior. So on the huge database that we sit on, and I'm thinking here specifically about the German market, we have all this data related to a subset of the German physicians. We can throw a query at that with a bunch of variables. Those variables might be something like this physician or these groups of physicians have been visited by a marketing professional or they have not. And from that, you can test out how that impacts their prescribing behavior for a specific drug, a specific therapy, or whatever. Brand awareness, market sizing, where are the patients, what are they doing? The drug impact, the patient journey. I think sometimes we don't talk enough about the benefits to just general society for this. We're obviously very revenue driven these days, but actually, if you think about it, we're pretty unsophisticated in terms of our understanding about how these things are working across countries. As a project and as an organization, I think we're doing a lot to help understand exactly what's going on in these complex examples where you have a lot of other external factors operating on the patient and the drugs that are at play. So obviously it's critical we understand that. Another example, doctor benchmarking, right? So we want to incentivize these doctors and various other organizations like hospitals to deliver information to us. And we can often do that not with monetary incentivization, but giving them reports and information and data back. So for doctors, the specific example I'm thinking of here, we want to aggregate doctors to somewhere where it makes sense. So I might be a pediatrician working in southern Germany. I want to be able to compare myself against other similar German pediatricians to see what they're prescribing, what patients are they dealing with. Just this kind of stuff that it makes use of the data for them and that they find interesting. So we deliver that back to them, and in return, we receive their data. So the specific project that I'm working on is called the Real Data Factory. And what we are is a curation platform for longitudinal patient real-world data. So we are basically taking, if you can imagine the amount of different data sets that we're working with across all these different European countries, even within individual countries, you have a complete range of sources coming at you. You've got like one 75-year-old German doctor who's handwriting notes in some fashion, and then you've got a very young Swedish guy who's putting everything in methodical detail into a software system. Our platform is taking that and putting it into a common, using a common reference system and specific schema that allows you to compare and analyze across the different data sets. So this is for our internal stakeholders and across different countries, whether it's the regional or global units. and for individual countries or multi-country. But really the key thing is that it allows them to compile this information and deliver results to clients quicker and more efficiently, and therefore cheaper. And it's allowing them to access it, like I say, in an efficient, fast, flexible way. So I want to talk a little bit about our experience with Looker and why we use this tool. Now, we're very, very immature in our journey compared with the other examples that I've heard to date. We only started the integration work in January. So, a lot of what I'm discussing here is not necessarily real life examples to date, but the discussions, shall we say, rather than arguments that I had with my senior management about why we needed to start using yet another BI tool internally. Because we are obviously dealing with data as a business. We have pretty much every BI tool that's available out there sitting somewhere internally in IQVIA. And we've also built a hell of a lot of them as well. So, there was, without doubt, a large exhalation of breath when I walked into the room and made a request that we should be getting another one. But we did this, I think, in a very successful way. And the argument that has really resonated internally is that we base everything around this modeling layer. The LookML modeling layer, as you all know, Looker was originally built around, and they built the visualizations on top. And what we're able to we have successfully argued is that internally, at the moment, we have this legacy process a little bit too much. I'm not saying this is the case across the board, but there is a tendency to have a lot of very technical people working in silos, performing the same work, potentially producing different results because they are completely siloed off and working independently. The process that we are trying to produce with RDF and via the modeling layer of Looker is that we have a very small team of analysts working collaboratively, ensuring that they are producing consistent stuff and that all the back end is all reusable, so that when it comes time for the business user to pick it up, they can guarantee they're going to get the same results, and also they don't need 3 PhDs to be able to pull the data out. And of course, for RDF, this complements our strategy perfectly. It goes completely in hand with this, being able to facilitate the access to the data in a commonly viewed way, rather than having people working with different methodologies on different data sets. And of course, as well, the fact that it's all on a single web-based system for us was very important. We therefore can ensure that the front-end stuff is all reusable and visualized as well. But really, as what is a very large, sprawling organization, we can ensure that we have much more of a collaborative approach, all working consistently within one central location. So this is the argument that we've had with management to procure Looker, and we're now taking to use cases, and it is resonating really, really well. So obviously, for us, we work with sensitive data. Data privacy is top of the agenda. For us, the fact that Looker works in database is very key. We have some specific examples where we work with hospitals that will just not allow any data to ever leave their database. So we can now say to them, that's fine, we will take the tool to you, we'll throw a query at the database, and we'll return the results without removing any data. For GDPR, obviously, it's hitting everyone at the moment. The fact that we now have a clear audit trail is incredibly important for us. And also, not just from a GDPR perspective, but for a local office data owner, these guys have to understand and know exactly who's looking at the data, what they're doing with it. The fact that we can track all this in the back end is very, very important. So I wanted to, not just because they're paying for my dinner, but also because they genuinely have been very, very good. See Cabs in the audience here. He's been working, our POC, it must have broken records for you guys, I'm sure. Mainly because I came on board in January 18 and made them restart it. But it went on, I think, for a year and a half or nearly 2 years. So they worked with us diligently on this stuff, and really it's been a fantastic customer experience all the way through to integration now. So like I said, we started in January. Really been fantastic support the whole way through. Let's talk a little bit about the arguments. I mentioned how difficult it is when you start talking about getting a new BI tool internally in IQVIA. One of the biggest arguments that came my way, or certainly one that was repeating itself quite a lot, was the fear that people had about this LookML thing, really not sure, do we need to be adding in yet another type of coding? And the counter to that, of course, was well, firstly, it's still SQL, and you only need an intermediate knowledge to use it. But the API functionality, so we said, actually, look, yes, we are a single project within a larger organization. If we are building something that's of value elsewhere, we can just API it within. We can just embed within your components. And we're actually using that within our own project anyway. So within our POC that we ran, we wanted to ensure that we could build some of the most complex logic that we have that we're working with internally, and that we could embed that within Looker. So this is a good example, I think, of that. This is called sources of business logic. And so if you can imagine you have a patient who is, like I mentioned before, these guys aren't just working with single therapies in real life. They often have multiple different therapies ongoing for different results, for different diseases, all of which you want to be able to track and understand which is the dominant one, which is the mono episode, and where we have multiple ones ongoing. You can see with this logic, this is what we were trying to replicate. We ended up building this in Python and injecting it in. And I think this really started the developers salivating when they saw this stuff. This is really good. We built it out in the end pretty quickly. And I just wanted to use this as an example of the kind of complex logic that we were able to build out in Python, inject in, and then we visualize this in Looker, again with the embedding functionality. This is a slide that I've shamelessly ripped off from Looker marketing, but only because it perfectly represents what we are actually, how we're deploying in real life. Now we have some real life use cases. So we have, I think, and again, it's initially, we've started with these very disparate use cases, but already we're seeing overlap between them. And when you see the use cases and the business units here, I think it's better for us to talk about these as actual use cases, because they are so different internally for us. And the key thing is that we have this central team working on the coding, the modeling for this, so that over time, the overlap between them gets greater and greater, and the work on my team, the central BI team, is reduced as that overlap gets bigger and bigger. And we've had a perfect example of that initially. The feedback reports for doctors that I mentioned before, where we return the data to them and we want to aggregate and be able to compare. We've had a new use case where we work with Spanish hospital data. So they want to test oncological impact. So cancer treatments, how is that impacting cancer patients? And for them, the incentivization back to the hospitals is, how do I compare as a hospital against other hospitals? And completely different data, right? You've got cancer data at the hospital level rather than doctor level, prescription behavior. But actually, the modeling work that's gone into it is actually pretty similar. So on the back end, we're able to completely reuse that. And we're just getting going. We're in our first quarter, and already we're seeing the benefits of having this core model that's controlled and maintained by this central team. That's the real key thing, is ensuring that these guys are the ones that are constantly doing it. That knowledge is retained within the group. But we start to, and we're already starting to do this, we start to recruit these, and I think it was Neil in the presentation before me was talking about this as well, having a data owner within these individual teams. So we have case study. This is, I think, a perfect example of how we're looking to deploy. We have individual units that we're working with. We're going to them and saying, okay, how are you guys currently managing reporting? And how is that going to look after we're taking your data and we're funneling it through the RDF curation pipeline? So at the moment, these guys they're going to directly to a database. They're collecting it. They're then defining their market. So, what's the therapy I want to look at? What's the region? And then what's like a subset of, say, disease classifications like ATCs or ICDs within that I want to look at. They then model that. They get, they have a range of different tools like Alteryx, or they're just doing it themselves, or we've got in-house built ones, or you just get, but it always requires very technical people to be doing it. And they then have a third tool to perform the visualization. With Looker, we are arguing that we will do all of that within one central tool for them. And the benefits of that are that we are able to say, okay, there is no technical skills required outside of our little group. You guys can be flat out business users. You don't need to have a ton of technical knowledge to be able to work across these different systems. You don't have to work in isolation. Everyone's able to see it. Of course, within a governed framework, again, you don't necessarily want to just release all these reports to everyone. A lot of times it's quite valuable. But should you wish to and should you need to, now you're actually able to do it. You can see, okay, I'm working with a client, like, say, Roche in France. I want to know what someone working in GSK in the UK is doing. Is it similar? Can I reuse it? With this centralized approach, you're absolutely able to do so. And if that person gets hit by a bus tomorrow, the work is immediately replaceable, which is obviously the key factor. Okay, so yeah, I ended the presentation with this slide. Obviously for us, we are completely convinced that Looker has been the right technology decision for us. And yeah, thank you very much.